Hello, everybody. Good morning, good afternoon, good evening, depending on where you're listening from. This is Dr. Deka Ifobi. We're going to talk headaches today. I know we've all had headaches. Today, I'm going to focus, however, on the red flags, meaning when these things happen or when you notice this, then it is important that you seek care because this could be worrisome and not just an ordinary headache. So I'm going to talk about a mnemonic SNOOP 10, SNNOOP 10, the number 10. Number one, systemic symptoms, meaning if you have a fever with a headache, you need to seek help. Number two, neoplasm or cancer. If you've had any type of cancer, you need to consider seeing somebody if you have a headache like that. Next, neurologic deficit, meaning if there's something wrong neurologically, meaning if you're having excessive sleepiness, loss of consciousness, decreased alertness, things like that warrant care if you have a headache. And next, the onset is abrupt, meaning all of a sudden you got a headache that just boom started. You need to seek care. Next, older age. If you never really had headaches and then you're over 50 and all of a sudden you have a headache, you need to get help. Next, pattern change, meaning your headache has changed. You normally have a headache with a little dullness behind your eye and all of a sudden this is a thunderclap headache or a headache all through your head or something different about your headache warrants further care. Next, positional headache, meaning when you change positions, this headache comes. For example, you're laying down, you sit up, you have a headache, that warrants care. Next, headache that's precipitated by sneezing, coughing, or exercise. Exercise-induced headache, coughing-induced headache, sneezing-induced headache, you've got to seek care. And even headache that occurs during intimacy, you gotta seek care. Next, P stands for papilledema, which means swelling of behind the eyes. If this happens, we need to seek care. Next, progressive headache that presents in an atypical form, meaning all of a sudden you have a headache that just has been ongoing and just will not relent. We need to seek further care on something like that. And next, we talk about pregnancy or postpartum period. If you're pregnant and you have a headache that you've never had before, you need to seek care. Or you've just given birth and during your postpartum period, you have a headache, you need to seek care. And next, what we call painful eye headache, meaning you have a headache behind your eye really hurts, and you may even have watering of your eyes and so forth, that warrants care. And next, when you're under any type of immunotherapy, meaning you're taking some sort of cancer drugs or you're taking chemotherapy drugs for arthritis, for psoriasis, things like that, you need to seek care. And we correlate that with the word P, pathology of the immune system. And next, painkiller medication overuse. This is crucial. You've had a headache and you've been taking either ibuprofen or acetaminophen, drugs called or any type of headache pain relief that you're taking on a daily basis, especially more than 2 weeks. That is called a painkiller headache or medication overuse headache. You need to seek medical care. All right, I hope that helps. Dr. Deka Ifobi, keeping it real.